Viruses are tiny genetic invaders that hijack our cells to multiply, making us sick in the process. Antiviral drugs are designed to disrupt this process, stopping viruses from multiplying and giving our immune system a fighting chance. Unlike antibiotics, which target bacteria, antivirals are tailored to attack viruses, organisms that aren't truly alive, and use our own cells to replicate. This makes developing antivirals much harder, which is why there are fewer of them compared to antibiotics. Before antivirals, doctors could only offer supportive care for viral illnesses like HIV or hepatitis. The arrival of these drugs transformed deadly infections into manageable or even curable conditions. Antivirals now help control outbreaks of influenza, manage chronic hepatitis, and treat herpes infections. Their power lies in targeting unique steps in a virus's life cycle, blocking entry, halting genetic copying, or stopping new viruses from escaping the cell. Each antiviral is a precise tool, designed for a specific virus and process. This targeted approach is why developing new antivirals is slow, but also why they're so effective. The more we learn about viruses, the better we become at designing these life-saving medicines. Antiviral drugs come in several classes, each targeting different viruses. Anti-herpes agents, like acyclovir, treat cold sores, genital herpes, and chickenpox by controlling outbreaks and reducing symptoms. Anti-influenza drugs, such as oseltamivir, Tamiflu, can shorten the flu and prevent complications if taken early. Antiretrovirals are the backbone of HIV treatment, using combinations like tenofovir and emtricitabine to suppress the virus and restore immune function. Anti-hepatitis drugs, such as sofosbuvir, have revolutionized hepatitis C treatment, offering cures for most patients. Broad-spectrum antivirals, like remdesivir, show promise against multiple viruses, including those causing pandemics. Each class is a result of decades of research, targeting the unique biology of different viruses. These medicines are essential tools in modern medicine's fight against viral diseases. Antivirals work by sabotaging key steps in a virus's life cycle. Anti-herpes drugs like acyclovir mimic DNA building blocks, tricking the virus into halting its own replication. Anti-influenza drugs, such as oseltamivir, block the enzyme that lets new viruses escape infected cells, trapping them for the immune system to clear. Antiretrovirals for HIV attack multiple targets. Reverse transcriptase inhibitors block the conversion of viral RNA to DNA, while protease inhibitors prevent new virus particles from maturing. Anti-hepatitis C drugs like sofosbuvir mimic RNA building blocks, stopping the virus from copying its genome and leading to a cure. Each drug is designed to disrupt a process unique to its target virus, minimizing harm to our own cells. This precision is what makes antivirals so effective, and why their development is so challenging. By understanding viral biology, scientists create medicines that outsmart even the most elusive viruses. These tactics have turned once deadly infections into treatable or curable diseases. Antivirals are a triumph of targeted medical science. While antivirals are powerful, they can cause side effects because they act inside our cells. Anti-herpes drugs like acyclovir may cause mild nausea, headaches, or, rarely, kidney issues at high doses. Anti-influenza drugs such as oseltamivir often lead to nausea or vomiting, and occasionally headaches or rare neuropsychiatric effects, especially in children. Antiretrovirals for HIV can cause fatigue, vivid dreams, and over time, changes in metabolism or organ function, requiring regular monitoring. Anti-hepatitis C drugs are usually well tolerated, with most people experiencing only mild fatigue or headaches. Drug interactions are a concern, especially with hepatitis C treatments, so specialist management is important. Most side effects are manageable, but close communication with healthcare providers is key. Understanding these risks helps ensure safe and effective treatment. Managing side effects and preventing resistance are crucial for safe antiviral use. Dosing is tailored to each patient's age, weight, and organ function to avoid toxicity. Regular blood tests help monitor for side effects and ensure drug levels stay safe. Adherence is vital. Missing doses can let viruses mutate and become drug-resistant, especially in chronic infections like HIV. Patient education and close follow-up are essential for success. Antivirals are powerful tools, but their benefits depend on careful use and monitoring. With the right approach, we can treat viral infections effectively and safely, improving health outcomes for all.